Hello, everybody. I'm so excited to be live from Health Europe. My name is Demi Radeva, and I'm guest anchor for Hit Like a Girl. And today with me, I have Valentina Milanova, founder and CEO of Daye. Valentina, how are you?
Exhausted, but I'm happy to be here.
Tell me about this exhaustion. What has contributed to this?
It's summer, so it's conference season. Within Daye, I'm responsible for a lot of our B2B sales and business development, which means I am on a plane every week.
Wow. Well, we're so glad to have you with us. Can you tell me a bit about yourself and your journey? And I was actually super positively surprised. I'm Bulgarian, you're Bulgarian. It's awesome to see another amazing Bulgarian woman just changing the world. So how does that feel?
Yeah, I'm Bulgarian. I'm the founder and CEO of Daye, a women's health development platform based on proprietary medical and diagnostic devices, which we pair with custom telehealth solutions. And our aim is to help bridge the gender care gap and the gender research gap, and to ensure that women have gender parity in the delivery of healthcare, because we think that one of the biggest issues within society and our economies today is that we have over half of the population who's incredibly talented, well-educated, perfectly capable, frequently drop out of the workforce or not be able to live up to our full human potential due to the fact that we know so little still from a scientific perspective how to diagnose the female physiology or how to treat the female physiology. So that's what we do at Daye. We're dedicated to helping bridge the gender care gap, the gender research gap with deep tech and biotech innovation.
What inspired you to start Daye and specifically to begin with such a stigmatized product as a tampon?
Partially my personal experiences within gynecological health. I, like many women, had a number of gynecological health horror stories growing up throughout my teenage years, throughout my early 20s. But then on a broader level, I really genuinely believe that solving for better women's health is the single most important thing that we have to do within our lifetime. I don't think that's a challenge that we can pass on yet again to another generation. I don't think we can afford to do that. So I'm excited to help bring more medical innovation to the space and ensure that we're not stuck at home with a hot water bottle or dropping out at the peak of our professional development due to unmanaged menopause symptoms, for example.
Daye started with CBD-infused tampons and has since evolved into diagnostics. What has that transition been like, and how did your vision expand?
It wasn't really a transition. So the core hypothesis that we've always had at Daye is that a lot of women use tampons already. Something like 90% of the general female population use tampons on a regular basis or from time to time. So the key idea was, how can we make an existing product that's already part of your routine work harder for you? So we started with the invention of the world's first cannabidiol tampon, which is a clinically validated medical device that has supported over 100,000 patients in the UK. And we then introduced the diagnostic tampon, again, building on an existing medium that's convenient, familiar, in order to enable at-home self-sampling for sexually transmitted infections, vaginal infections, but also the HPV virus, which causes cervical cancer.
I'm curious, you mentioned patients. What has been the feedback so far? How have you leveraged feedback in the development and the evolution of the company and the products?
We really think of our customers and our patients as the co-creators of our products. So we have a lot of really tight feedback loops. There's a monthly NPS survey that we send out to everyone who's an existing customer or who has churned. This allows us to continuously keep a finger on the pulse of how our products and services are performing. Then separately, we have really extensive post-market surveillance surveys every 6 months that allow us to perform in-depth analyses of the real-world performance of our products and services. And then before we have a product on the market, we work with focus groups and questionnaires in order to enable the final patient to give us a lot of comprehensive feedback as we're designing the product and as we're iterating. Because we design and manufacture our products in-house, we're able to have a much faster product iteration cycle. So we're able to much more quickly implement the feedback that we hear.
We are at Health Europe and we're live at the conference, and I'm curious on what's your perspective on the VC and the customer landscape in Europe versus the US, specifically when it comes to women's health innovation?
I think we have a very exciting opportunity in Europe to rise up with everything that's happening in the UK. Post-Brexit, there have been a lot of economic challenges. There are a lot of societal challenges. There's a lot of division within the UK. Similarly, in the US, the society has become super polarized. There are issues, particularly in the delivery of healthcare. So I'm very excited about how Europe can take this opportunity in order to become even more united and to lead in the leadership vacuum space that has been left behind by the UK leaving the EU and the US being where it's at. And given that the UK and the US have, instead of forming strategic alliances with other geographies, frequently stood against them, I think there could be a really exciting opportunity for Europe and India and Canada to work together to form a new alliance that's focused on improving the way in which we do medical research, improving the quality and safety of products, and making our societies and economies better, healthier, stronger.
So at Health Europe today, we have a full day of a Women's Health Summit programming. I'm curious if there's any sessions that you're excited about attending. I'm curious also, what's the word on the street, or what are things that you've heard being discussed in and around the conference? I've been hearing a lot of terminology around Femtech, women being the CMOs of the family, things like that. Are these type of terms and buzzwords holding women back and holding women's health back, or are they actually helping?
We're so far behind on the way in which we deliver women's health that we don't need a bold vision. We need a lot of basic fundamentals to be delivered. At-home cervical cancer screening, better options for hormonal contraception, more personalization in the way in which we provide HRT and hormonal contraception as well. Better management and recognition of the impact of period and pelvic pain on the well-being of the patient, as well as on their ability to take part in society. So there's so much that we can do by restructuring our existing processes and investing just a little bit more in women's health, because currently we invest so little. The budgets are pitiful. The UK has £25 million per year for the whole of the UK for women's health hubs, which is woefully inadequate. It can't even be ring-fenced just for women's health. Even though it was appointed for the women's health hubs, it can't be ring-fenced just for women's health. So if we invested just a little bit more, the economic case is so clear, the return on investment is so clear. There's a study after study that shows how when we solve for the female physiology and when we create solutions that enable women to not be held back by our female physiology, we produce meaningful societal and meaningful economic returns. I'm really hopeful that they can play a role through our medical devices, through our tangible solutions, through the tools that we build, in ensuring that every woman and AFAB individuals can live up to their full human potential.
Amazing. Well, thank you so much for your time. I appreciate it. And thanks for building something amazing for women.
And thanks for having me.
Thanks for listening. You can learn more about us or this guest by going to our website or visiting us on any of the socials with the handle HitLikeAGirlPod. Thanks again. See you soon. Again, thank you so much for listening to the Hit Like a Girl podcast. I am truly grateful for you, and I'm wondering if you could do me a quick favor. Would you be willing to follow or subscribe to this podcast, or maybe leave us a rating or review? Or if you're feeling extra generous, would you share this episode on your Instagram stories or with a friend? All those things help us podcasters out so much. I'm the show's host, Joy Rios, and I'll see you next time.